What is it like to be an anesthesiologist?
In essence, I like to tell families, since I do pediatrics mostly, that it's the most expensive babysitting that we could ever do.
So people have a fascination, they have a love for supplements. I certainly take probably 20, 25 supplements a day. Why do you think people will take supplements, but they don't like to take medication?
And the answer was always ridiculous. The answer was my grandmother's uncle's brother said it was good for you. Or, I saw it on TV. And I decided that that was the worst way of determining what you were going to put into your body.
But you have something called the Panacea. So let's talk about that, where you have about 5 supplements that you recommend.
People will recognize resveratrol because it's in red wine. Pterostyl conversely, is in blueberries.
I want to talk to you about something that was amazing to me about hyaluronic acid and dehydration.
Hyaluronic acid is one of those, it sounds horrible, right? It's an acid, it sounds terrible. And most women will know about it because we slather it on our faces.
Slowing the aging process has eluded humanity since the beginning of time. However, the emerging field of anti-aging and regenerative medicine focuses on understanding and addressing the root cause of aging. Protecting cellular health is not only crucial in combating aging, but plays a key role in preventing the many diseases associated with the aging process. Today's guest is Florida pediatric anesthesiologist, Dr. Sandra Kaufmann. Dr. Kaufmann is the author of the Kaufmann Protocol, Why We Age and How to Stop It, and her newest book, Aging Solutions, which explains everything you need to know about supplements that promote health and longevity. Her books are rooted in her expertise in cellular biology, her extensive experience as a physician, and thousands of hours of scientific research. Dr. Kaufmann's goal is not for people to live longer, but to also live better. Dr. Kaufmann, thank you for joining me today on Open Your Eyes Radio and podcast.
Thank you for having me.
And I should say, you want us to live longer. So I do want to ask you, what is it like to be an anesthesiologist? I don't know if many people have asked you that. I know that's your day job, but what is it like, because as a patient, we're the ones that are out under anesthesia or our loved ones, and we really don't know what's going on for the anesthesiologist. Sometimes I think it's like an airline pilot. Everything is really good until it gets really bad. So tell us what that world is like.
Oh, interesting question. I think that's spot on, in fact. We do. First, we are people and we talk to people and we sort of accumulate medical issues and look through drugs and allergies and all that sort of thing. And then the flight starts, right? Takeoff and landing are always the hardest parts. And in the middle, we're just monitoring for vital signs and doing what's appropriate. In essence, I like to tell families, since I do pediatrics mostly, that it's the most expensive babysitting that we could ever do. Right? I stare at their child and their vital signs and I give them whatever they need, titrate to pain or discomfort or this or that or the other, wake them up and we're done. And that's that.
And can an anesthesiologist during the surgery, is there downtime? Can they read? Is there things they can do, or they have to be focused on the screens?
So, it's very interesting. No one wants to hear that their anesthesiologist is reading or doing something else. But in reality, you can't stare at a screen absolutely forever. So what tends to happen is you stare at it, 90% of the time. And then, you look away, you look at something else, and then you look back. Because if you stare at something, you sort of lose pieces and parts. So you constantly have a scanning situation. You look at the heart rate, you look at the blood pressure, you look at the saturation, you go here, there, and then you sort of go back to the beginning. What are the fluids? What are the drugs? What can we make better? What's going on with the surgery, so it's a lot of action. I'm sure some people in very, very long, boring cases, maybe don't pay the attention that they should. But in general, we're pretty an alert bunch, I have to say.
It's interesting because as an optometrist, I know who the best cataract surgeons are. They come to me and I know who the bad ones are. I know who the average ones are and who the good ones are. I guess that's kind of the same thing with an anesthesiologist. You know who the best surgeons are and who you wouldn't, if it was your child or your friend, if you weren't doing peds, you would refer to. Is that the case?
Oh, 100%. I think that half of my phone calls during the day in the world of anesthesia is, my child needs X procedure. Who do you recommend? because we see the good ones, we see the bad ones, we absolutely know what's under the covers. Yeah, so that's what we do.
So how did you get into aging, anti-aging? How did you get interested in that?
So good question. So I was a cell biologist before I went to medical school. My father pointed out as I was in the middle of cell biology studies that cells don't pay bills. So I thought, better go to med school. But I've always been interested in cells as the root of pathology. And, about 10 years ago or so, I decided that this aging business was for the birds. And I thought, you know what, I'm going to figure this out. So my little ego decided that I personally was going to unravel cellular aging. And I just went on this ridiculous quest to figure out why we sort of age on a cellular level. And then more importantly, how to decelerate that process using biochemical sort of manipulation.
Your website is very good. I mean, and it's very kind of you what you have on your website because you have all the supplements that you've that you've researched and you give them all a grade. Can you talk about the grading system about supplements? About 75% of adults take supplements. So people have a fascination. They have a love for supplements. I certainly take probably 20, 25 supplements a day. I know I've heard you say up to 70 maybe a day. And where a lot of people in the health and longevity field, or people interested in health and longevity, they don't want to take medication, but they'll take a million supplements. And I find that a very interesting dichotomy. And if you could, one, tell us about your scoring system, and two, why do you think people will take supplements, but they don't like to take medication?
You know, you are spot on in that observation, which I find really funny. But so the rating system is, I have to back up a little bit because it's not going to make sense exactly unless I explain a little bit of background. So when I decided that you age because your cells age, I decided that cells age in 7 specific categories. And sort of in order, it has to do with like tenet 1 has to do with like the way your DNA falls apart over time. And 2 is mitochondria. That's the energy system for your cell, right? 3 is pathways. Like there's cellular pathways that sort of you need or not need as you get older. So there are 7 categories, much like that. And then the question is what supplements or adjuvants would you take to reach certain goals? And when I started down this process about 10 years ago, I would ask people, well, why do you take agent X, whatever it is? And the answer was always ridiculous. The answer was my grandmother's uncle's brother said it was good for you. Or, I saw it on TV. And I decided that that was the worst way of determining what you were going to put into your body. So this rating system evolved from the idea that different supplements or adjuvants do different things in different tenets of aging. And that we know certain things about them, but we don't know others. So in effect, my rating system is an efficacy knowledge system. So to be more specific, in each tenet for each agent, there's a 0 to 3 rating scale. So if an agent does nothing, as an example, in your DNA, it got a 0. If there was an evidence that it did something in a test tube or a culture that was positive, it got a 1. There's evidence in non-human mammal studies, it would get a 2. And if there was strong evidence in humans, it would get a 3, right? So now all the agents that I've looked at, I think I'm up to 50 or 60, come with a 7-digit rating number. So it would be like 0.3.2.1, representing what we know about the agent and how strong it is in each category. And the idea then is when you come to make up your own longevity protocol, you can line up all of your numbers and make sure that you have all of the different categories of aging sort of taken care of.
But you have something called the Panacea. So let's talk about that, where you have about 5 supplements that you recommend that pretty much, if you take these 5 supplements, you cover most of your 7 tenets or 7 principles of aging. So let's start with P.
P. So P basically stands for pterostyl. There's a family of plants or molecules within plants called the stilbene family. So it's basically pterostyl or resveratrol. And people will recognize resveratrol because it's in red wine. Pterostyl conversely is in blueberries. But the reason that these are important is because They do many things in many categories, but their strongest focus is that they are sirtuin activators. And sirtuins are a pathway in your cell that basically control all cellular homeostasis. Everything from DNA repair to oxidative stress to circadian rhythms. I mean, there's a huge laundry list. But after the age of 40, you are sirtuin deficient and it must be activated. So that's the P.
So with sirtuins, those are proteins, right? Or amino acids?
Actually, they're enzymes,
They're
right?
enzymes.
So they're enzymes. They are, by definition, they are histone deacetylases. So they're epigenetic modifiers that take acetyl groups off of other enzymes and proteins. So they sort of are like very fancy on-off switches in your cell.
So if you had to choose between astaxanthin and pterostilbene, which should you get, or should you get a supplement that has both of them? And how about for yourself? What do you take? You take a combination, or you just take one?
So I loved how you jumped to the A because we haven't gotten there yet. So the question is pterostilbene versus resveratrol. And the answer is sort of a combination. So resveratrol is a great molecule, but it's not as bioavailable, meaning you have to take a ton of it to actually do anything. Pterostilbene is more bioavailable, but there's fewer studies on it. In fact, the only downside to pterostilbene is there is one study that suggested that if you had any lipid panel issues like high cholesterol or something, that maybe that wasn't as good for you. So if people have cholesterol issues, I recommend resveratrol. And if you don't have any issues, I actually go back and forth because I think they hit the system slightly differently. And I think that sort of thing is synergistic.
So A is astaxanthin, and I've taken astaxanthin for many, many years, and I've noticed that, and this is what they say actually in the literature. I go outside and I don't get sunburned with astaxanthin. Now, I'm not telling people take astaxanthin and go sit in the sun for 4 hours, but I could tell someone who's very fair skinned like me, I don't get sunburn anymore with astaxanthin. And they talk about that literature, but you're an expert on astaxanthin. Is that true, what I'm saying?
Oh, it absolutely is true. So from a scientific point of view, it's a free radical scavenger. And what happens is when sun or other UV radiation hits your cells, it creates free radicals, which means a little extra electrons floating around. And those little electrons destroy your DNA, causes a lot of inflammation, which is how you get red. So by sort of sitting around in your tissues and sucking up these free radicals, you don't get sunburn. So scientifically, it should work, and realistically, it works. So I live in Miami. My kids live in Miami, and I have very, very pale skin, as do my kids. And I always talk about my redhead, who plays a lot of tennis in Miami, and she's my astaxanthin tester. When I buy a cheap brand, oh, she tells me, you know. So I use the good stuff, and it works.
MacuHealth is a nutritional supplement leader. Our targeted formulas include MacuHealth for daily eye health, MacuHealth Plus for aging eye support, Vitreous Health for vitreous care, Vision Edge Pro for visual performance in athletes, TG Omega-3 for ocular and systemic wellness, and MacuHealth DM for eye and metabolic support. Call MacuHealth today and mention this podcast for special discounts. Experience the difference with MacuHealth. Nutrition you can see.
I noticed on your website, you actually have brands. You'll have first and second or two choices. Now,
Yeah.
the one that's first, is that the one that you like a little better, or you like them about the same?
Not at all. The only reason I put that on there is when I don't put brands on there, people bug me to death. What do I use? What do I use? What should you use? What do I use? So I don't get paid for it. I have no affiliations with these people except for spermidine. It's what I personally use so that I know it's a good quality company with good effects.
So how about IgA? It increases IgA. Can you talk about that?
Sure, absolutely. So your immune system, obviously, so your immunoglobulins, here's a fast lesson on immunoglobulins. It's this little protein that people see sort of in diagrams that looks like a Y. And depending on how many Ys are connected, it's an IgA or an IgG or an IgM. IgA specifically lives in your mucous membranes and helps prevent infection from stuff coming into contact with your skin, your mouth, your nose especially. So astaxanthin has been demonstrated to increase your levels of IgA and therefore reduce the risk of colds and such. And I will tell you, I took a ton of astaxanthin, what I always do. But I really think that it reduces the incidence of, a lot of the coronaviruses that come in through your nasal mucosa.
Very good. So the next one on the Panacea is NAD precursors. So
Right.
tell me about the precursors and NAD and NAD plus. And it's very confusing to the public about NAD, whether they should take an injection, whether they should take an IV. Can they just take NMN or NR, the precursors? So tell us a little bit about that.
Sure. Well, I'm going to start with the question is like, why do you take it in the first place? So here's my 30-second spiel on that. So NAD, you use more as you get older and you make less. So you're going to be deficient. And you use it because it is in your electron transport chain that sits in your mitochondria to make energy. So when you are deficient, you have less energy. And I hear that from people all the time. Number two, you actually use the molecule to fix stuff in your DNA. So for example, if you're out in the sun, you get a little lesion, your DNA gets glued together, your DNA repair processes come through, take out the chunk, and then they use the NAD molecule to actually fit it back in like bricks building a wall. All right, so that's important. The third thing it does, it is actually a cofactor for your sirtuins. So we talked about resveratrol and pterostilbene. If you are NAD deficient, they're not going to work. So you have to do both of those together. And then lastly, it's sort of a communication device telling your cell between the nucleus and the mitochondria how much energy your cell has. So NAD is extremely important, right? So then the question is, well, which one do you take? You can go directly with NAD, which has to be IV or an IM injection. The problem, I think, with the IV is that it's too much at one time. And I'll get to that why in a minute. I prefer the daily IM injections, actually, because I know they're getting to me. The other options are obviously the precursors. You can't consume NAD because your gut eats it alive. So you have to consume the precursors. And as you said, there's nicotinamide riboside, which was the first one, and then nicotinamide mononucleotide, which was invented or discovered secondly. And I don't really think it makes a difference which one you take because you get to the same place. There's just one enzymatic step apart. The thing that's new in this argument, I'm just going to keep going on my little tangent here for a second, is that NAD is intrinsically involved in circadian rhythms, right? So if you take NAD at the wrong time, you can actually destroy your circadian rhythms. So what you do need to do is take it at the correct time, which is actually mid-afternoon.
Interesting.
So a lot of people take it in the morning, they take it at night. The real answer, and I always tell them it's British, take it at tea time.
Now, you could take just straight nicotinamide, which
it's not very effective.
doesn't have soluble niacin. That doesn't work at all.
No, and you get a big flush with niacin, so people don't tend to do as well with that.
So soluble niacin, nicotinamide, you get the flush also?
I think I've never tried it, but all I know is that people don't tend to tolerate it very well.
Yeah, so I want to talk to you a little bit about, you mentioned people that have trouble sleeping. So I have a friend who's a physician also, and he's had trouble sleeping his whole life since he's like 18. And he's been on resveratrol and pterostilbene, but he's never been on NAD. So I'm going to suggest this to him and have him take it in the afternoon. And maybe this might be able to help him sleep for the first time in his life.
Well, if he doesn't, so what's very interesting, and I was in LA last week and I gave a big lecture on circadian rhythms. People, talk about how to sleep, and everyone talks about blue light and food and this and that and the other. But in fact, it's a very difficult, complicated molecular mechanism. And, we can go into that a little bit for your friend if you want, but 2 proteins put you to sleep, 2 proteins wake you up, and 2 proteins increase the oscillation of the circadian pattern. And unless you optimize all 6 of those, you're not going to sleep. That's just the way sleep works.
Tell me about those 6 proteins. What are they?
All right, so the two that put you to sleep are something called BMAL1 and clock protein. And they land on, they heterodimerize, they come together, they land on the E-box cassette, and then they make two proteins called period and cryptochrome, and those go back into your nucleus and turn off the other ones. So it's on, off, on, off, on, off. And then if you want to increase that cycle, there's something called ROR alpha and reburb alpha, and one depresses BMAL1 and one increases BMAL1. So the problem of all of that is that it gets wackadoodle with age, and we have to fix it.
And how can we fix it?
Oh gosh, see, that's a whole nother lecture unto itself.
Is there a quick answer or not really?
So the quick answer is NAD at the right time, sirtuins at the right time. If that fails, selenium, spermidine, and nobiletin will absolutely help you go to sleep. Those
And
are the
which sirtuin number?
So sirtuin 1 and 6 are the ones for sleep. So it's pterostilbene or resveratrol, and then fucodan, which comes from seaweed.
With more screen usage and indoor time, myopia, also known as nearsightedness, is increasing and getting worse in children. Now, certified eye doctors can prescribe MiSight One Day, the first and only FDA-approved soft contact lens to slow myopia progression in age-appropriate children. Visit CooperVision.com to find a Brilliant Futures certified eye doctor near you. Right before the break, we were talking about sleep and helping us with sleep, and you were showing how complicated it is, and it's very complicated. But talk about a little bit more, go into a little bit more depth, which somebody at home could really try to help themselves with sleep.
Okay. So the interesting thing is when you go to a lecture on sleep, and this is what drove me to do this in the first place, is everyone talks about the external stimulus that comes in. They're called Zeitgebers: light, food, temperature, and it all goes through your, well, the light anyway, goes through your retina to something called the SCN, the suprachiasmatic nucleus, and it causes those cells to oscillate in a circadian pattern. But what most people don't know is that every cell in your body, with the exception of testes and thymus, has circadian rhythms, right? And they all oscillate. But I like to use the analogy of the symphony with a conductor. Every piece in the symphony can play it, but unless the conductor gets everyone on the same page, they're very desynchronous. So if the SCN is intact and everything's going well and all your cells are in sync and everything's great, you sleep like a baby. As you age, however, there's a desynchronization where your peripheral tissues aren't matching your brain. You get a deficiency in BMAL1 and clock. You get a deficiency in period and cryptochrome. And then ROR alpha is also in decline. So what you have to do, because they're all sort of interconnected, is reconnect them sort of together. So the easiest, as we said, is increasing sirtuin 1,6. And it doesn't work without effective NAD. So it turns out that NAD, because it's a circadian pattern, and this is why I tell people not to get IV infusions, because any piece of the circadian pattern has to be short-lived, right? Anything that goes on, off, the half-life has to be such that it goes away in 12 hours. So it's replaced by something else, and NAD is the same way. And if you give yourself too much NAD at any one given time, it's going to last longer and it's going to destroy your circadian rhythms. So that is, my opinion, is kind of a big no-no. People that are young, it doesn't happen so much, but as you get older, it does. So daily NAD and resveratrol, roughly mid-afternoon, is the best, strongest thing you can do to get the process started. Once you've done that, then we add things. And I've got a chart on one of my presentations, but as I'd said, selenium increases BMAL and clock. Spermidine does the same thing. And the problem with melatonin, people always ask me that, melatonin will put you to sleep because you've got M1 and M2 receptors in your brain, but it doesn't keep you to sleep. And a lot of people always complain about that. And the answer is because that's not its job, right? The job of melatonin goes to sleep, and then all of these other sort of underlying cellular processes that no one talks about, that's what keeps you to sleep.
Interesting. So as we go through the Panacea, we're up to C. So let's talk about curcumin, a very strong anti-inflammatory. People always mix up curcumin and turmeric. Tell us the difference. Tell us why we should take curcumin rather than turmeric.
Right. So turmeric, and everyone says it slightly differently, is is where it comes from, right? That's the plant, that's the root, that's the spice. But only 1 to 3% at best of turmeric is actually curcumin. So it's just a very small quantity. It's one of the biochemicals within turmeric. And the problem with straight curcumin is that the bioavailability, meaning what gets into your body and how it's processed, is very, very terrible. It's just really low. I think it lasts about a half an hour all by itself. So over the last decade, there's been this escalating war of companies, which we benefit because they're trying to figure out how to make it more and more and more bioavailable so it's useful to us. Once upon a time, they added pepper to it. So if you're still using one with pepper, it's a little bit old-fashioned. They can liposomalize it. My favorite one is in a nanomycel. So at the moment, there's a great company called Rev Genetics, and I don't get paid by them. I just love the product. It's 277 times more bioavailable than standard, and they're so proud of it. The bottle says 277 on it, so you know what you're getting. But as an anti-inflammatory, it is absolutely outstanding. It is also an epigenetic modifier to a certain degree. It activates some AMP kinase to a certain degree, and it also decreases the accumulation of lipofuscin. So it does a lot of things that are just tremendously good for you.
How does it compare to ibuprofen?
It depends on
For anti-inflammatory, you have a little inflammation somewhere, or your knees bothering you or something, and you want to choose between taking Advil or taking curcumin, especially from Rev Genetics, which is the one I take, which is I find to be very, very good. It's very, I agree, the absorption is very, very good. So how about what do you think with head to head?
So I think that they're just different, to be perfectly honest with you, because if you look at the inflammatory tree, you start out with the interleukins and tumor necrosis factor alpha, and then da 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 da. It's just like it's this giant tree, and the different anti-inflammatories hit different aspects of the tree. For example, ibuprofen is up there. Shoot. I don't think it's as high on the tree. So you get some of the effects, but not all of the effects, right? And then you've got your class of COX-2 inhibitors, which are sort of midway side on a branch on a tree. Um, I like curcumin. I got to tell you, it hits at tumor necrosis factor alpha. That's like the main source. So I actually like that one. But I will tell you that sometimes for severe pain, I tell people to take a little bit of both because I think that if you hit things slightly differently, you get more of a symbiotic reaction. But I got to tell you, I live and breathe on metacurcumin. That stuff's amazing.
And with turmeric, only 2 to 5% of it is curcumin.
Yeah, yeah.
So you're not getting the full benefit if you're taking a turmeric supplement.
Not at all. Not at all. And I think that I saw an ad the other day on TV that some doctor was recommending some particular brand of turmeric, and I thought they must be getting paid for this because that's the worst recommendation ever. I mean, that's just not the way to go.
And with C, you have two C's. So you have carnosine, which helps with glucose and ages. So if you could explain that, and that's certainly very interesting to me as an eye doctor with cataracts. But certainly I see a lot of diabetics, a lot of people with diabetic retinopathy. The number one cause of blindness on the age of 55 is diabetes, and people need to start early to control their blood sugar.
Oh, without a doubt, without a doubt. So what happens is, and I'm sure your listeners probably know this, but I'll sort of just go through a little bit anyway. Glucose and other reducing sugars, sucrose, fructose, etc. Glucose always gets the bad rap, but it's actually not as bad as the other ones. Non-enzymatically, meaning it does it automatically, binds to proteins and DNA and lipids as well. And it breaks into pieces and it causes these things called AGEs, advanced glycation end products. And they're extraordinarily inflammatory, number one. Number two, they destroy the protein that it landed on. So this is one of the big reasons that collagen gets destroyed. So people with congestive heart failure without coronary disease, it's too many AGEs. Vision, cataracts, it's glycation and cross-linking in your lens. Anyway, it just causes innumerable problems. And so most people's solution is to eat less sugar, which is a great idea. I'm a junk food junkie and I shouldn't be proud of it, but it's just what I am. So as a consequence, I take like 4 diabetic medications, but despite the fact that I'm not diabetic. And I take a ton of carnosine. And so what carnosine is, it's a naturally occurring dipeptide, so 2 amino acids stuck together. It's in our bodies naturally. So it's actually not a supplement, it's or actually it is a supplement because we have things you don't normally have in your body are adjuvants. Things that you normally have in your body are supplements because you're supplementing your endogenous population. Anyway, whatever. Carnosine you already have in your body. Unfortunately, as you get older, you have less and less and less. And what it does is it's a transglycosylating agent. Trans meaning if the molecules float around in your body and glucose is stuck to another protein, it will lift the glucose off of that protein. It literally will rescue your tissues. So it's amazing. So it comes in an oral form and it comes, as you know, in an eye drop form. I've been using NAC eye drops, God, for a decade. And the good news is because of that, I don't have cataracts, nor do I have presbyopia. Like I'm 55 and I don't need glasses. I swear it's the eye drops.
You don't have presbyopia at 55?
I do not.
Do you need glasses for driving?
Nope.
A little bit? No?
Nope.
You don't
Not
have
at
a
all.
lot of nearsightedness? I'd love to examine you and see that. That would be amazing to see something like that. So speaking about supplements that lower blood sugar or help with blood sugar, talk to me about one of your favorite, Delphinidin.
Delphinidin. So
Right.
so one of the things I love to do is I love to travel and I love to find things that people sort of use endogenously, right? So I was hiking. I'm a big mountain climber. At least through a little hiatus, but I was a big mountain climber. So I was in Argentina climbing Aconcagua. And I've also been down to Chile on the southern Patagonian ice flats, and they're all eating acai berries, right? I'm like, what the hell's a acai berry? So it turns out they're very, very purple grapes, not grapes, but they look like these little purple berries. And the biochemical in them is delphinidin. So it is a free radical scavenger. It's water soluble versus astaxanthin that's fat soluble, and it is extremely potent, reducing some blood sugar, but mostly it's a free radical scavenger. But it is so good for you. It's amazing.
I understand it's good for psoriasis.
It might be. Psoriasis tends to be sort of autoimmune inflammatory, so it might because it is a scavenger, but it wouldn't be as good as some of the other things that we could use.
And when you take the Delphinidin, do you have any side effects to it?
None.
And what does it do to your blood sugar when you're doing labs?
It specifically, I have no idea because I take 70 supplements a day and 12 pharmaceuticals. So if you're going to ask me what one particular thing does, I can tell you theoretically, but not specifically.
Do your patients know what presbyopia is?
There are people who are afraid of the press.
Have you talked to your patients about multifocal contact lenses?
I've heard the bifocal, but not
right,
multifocal.
exactly, not multifocal.
Do you need help with your multifocal strategy? Learn more at the conclusion of this episode. I want to talk to you about something that was amazing to me about hyaluronic acid and dehydration. You know, I get a lot of patients that have dry eye, and we always tell them drink water. But we have people that drink water and it goes right through them. If they don't absorb it, it goes right through them. Their eyes stay dry. Their lips are still chapped. And that we might know the answer now. Hyaluronic acid. Tell us about that.
So hyaluronic acid is one of those, it sounds horrible, right? It's an acid, it sounds terrible. And most women will know about it because we slather it on our faces. Because we know that it's good for your skin. But what it really is just a chain of molecules, and it's an extremely long chain. And the size of the chain will dictate whether it's low molecular weight, medium molecular weight, or high molecular weight. So that's what you see on bottles. But in reality, regardless, a standard molecule of hyaluronic acid, one molecule will attract about 6,000 molecules of water. So I like to think of it as a molecular sponge. And as we get older, we don't make as much. The other thing that happens is when you are inflamed, you make an enzyme called hyaluronidase, and that actually destroys your own hyaluronic acid. So as you get older, you're making less, you're destroying it. So as a consequence, you can't hold on to water. There's nothing for it to stick to, right? And I love these women walking around these giant jugs of water. It's not going to do a damn thing. I mean, it's humorous, and I bet they got great kidney function. But in terms of actually hydrating your tissue, unless the water has something to stick to, nothing happens. So you absolutely should be on hyaluronic acid after the age of 40.
So tell me about how fibroblasts make hyaluronic acid.
So your fibroblasts are a cell type, and it sits usually in your skin, but they're pretty much everywhere. But famously that they're in your skin. And when they get stimulated, they make collagen and they make hyaluronic acid, and they make a variety of other things as well. But again, as you get older, fibroblasts don't do what they're supposed to do. So they don't make what they're supposed to make. But what's really interesting, and it stands true for both collagen and hyaluronidase. If you consume these things, your body breaks down the molecules into diantripeptides, for example, for the collagen, and then just smaller chains for the hyaluronic acid. And these go to your fibroblasts, and it stimulates them to make your own endogenous tissue. So you don't eat collagen and it sticks to you as the same collagen, but it's just a stimulating factor to make your own collagen. And it's frustrating because there's all these things on TV or newspapers that says, taking collagen or hyaluronic acid is garbage. But in fact, it's extremely useful.
And for people that have severe dryness, how long will it take once they start taking hyaluronic acid before you think they'll see a benefit? You recommend like 100 milligrams or 200 milligrams?
200 generally.
And how long do you think it'll take before they'll be less dehydrated?
My best guess would be about 2 to 3 weeks, because it's going to go through your GI system, and it's going to slowly get deposited throughout your tissues. And it's just going to take time to infiltrate all of your tissues.
And any foods that have it, I understand maybe sweet potatoes, garlic, onions have hyaluronic acid in it.
Yeah, a lot of things do. My issue is I always calculate like how much stuff you have to eat naturally to get where we are. And I didn't do the calculation for hyaluronic acid, but I will tell you, I love this example. So for pterostylium, which comes from blueberries, people are always asking, can I just eat blueberries? And I calculated that you have to eat 3 gallons of blueberries a day to have the equivalent of 1 capsule. And the same thing is for strawberries. I think it's like 5 gallons of strawberries for 1 capsule of fisetin. So I don't know how many yams or whatever it is that you'd have to eat for hyaluronic acid, but I can guarantee you that swallowing a little capsule is way easier.
Let's talk about bone health. You have a really good one for bone health. Tell us about that.
Oh, so I love naringenin. It's just fantastic. It comes from the Orient. And I could never pronounce what it's actually called, but it translates into fixes broken bones, which I love, right? It says it all. Comes from orange peel. So if you don't want to eat the peel, that's fantastic. An interesting peel also has nobilitin. So I think I'm just going to start eating orange peel. But it actually does. It activates your your osteoblasts to build bone. And for people that don't know, bone is constantly remodeling. Your osteoclasts break it down. Your osteoblasts, with the B, builds it back. And of course, as you get old, it becomes lopsided. So we have weaker bones. But activating your osteoblasts decreases osteoporosis and all of those horrible diseases. So naringenin is the way to go.
And what's the dose usually for naringenin?
I knew you were going to ask me that, and my brain just went, I don't remember. Isn't that sad? I don't remember.
Okay.
But it's in my book. It's on the website. How about that?
Okay, good. So I want to talk to you about repurposed medications. What are some of your favorite repurposed medications? Now, I know that, as doctors, we're not recommending medications to anybody, but medications that you may take yourself that you think might help with longevity. And so what are some of the ones that you like?
Oh, gosh. Well, I take about 12 a day, as I mentioned earlier. Goofy things. Let's see. So here's an esoteric one, but people love this one. So there's something called Selbex, Selbex. Okay. And it is not FDA approved in America, but it's FDA approved in Japan. And it's been FDA approved for 20 years. It treats gastritis, which seems bizarrely esoteric. But what it actually is, it's a heat shock protein activator, right? So that means it's a chaperone, which means that it helps refold proteins. And I'm sure people are like, I don't get it. What is she talking about? Most neurologic disease, including Alzheimer's, is a disease of misfolded proteins. So by refolding proteins via chaperones and heat shock proteins, you're actually reducing relative risk of Alzheimer's disease. So I import Cellbex as a way to ward off Alzheimer's.
Interesting. Now, before you were talking about your junk food junkie, how about acarbose? It was a medication that was used a long time ago. It's not really used very much. And I've heard of doctors grinding it up, putting it in a salt shaker, and when they want to eat something that's not too healthy, a bunch of carbs, they'll sprinkle some acarbose on it. What do you think about that?
Well, so I've tried acarbose. So what acarbose is so when carbohydrates hit the lining of your gut, we break it down. And there's two enzymes. There's alpha amylase and alpha glucosidase. And this just blocks those two enzymes so that you don't process carbohydrates. And it works. I tell you, that absolutely works. The problem is that you fart like nuts. I mean, it is not pretty to be around. I could spot someone on acarbose in a heartbeat. But there are other ways to cheat the glucose cycle. In fact, I've got this great lecture on 7 ways to decrease glucose issues. You can decrease absorption. You can decrease processing. You can transglycosylate. You can pee out extra glucose. You can do all sorts of wonderful things.
Give me another one for glucose.
So let's see. So there's a family of drugs called the flozins. That's canagliflozin, dapagliflozin, empagliflozin, and these are sodium glucose reuptake inhibitors.
Oh, this SGLT2 inhibitors.
Correct. So what happens is your kidneys filter out all of the glucose from your vasculature, right? You've used what you're going to use. This just filters out all of it. But your body generally sucks it back in. They reuptake it. So by blocking the reuptake receptors, you basically are peeing out all the glucose you didn't use. So, I mean, I will tell you that your urine smells a little bit funny, but you just dump a ton of glucose. So you can't become hypoglycemic. You're just not becoming hyperglycemic.
I want to thank Dr. Sandra Kaufmann for joining me. People want to find out more about you. Where can they find out about you? Tell us a little bit about your books in the last 30 seconds.
Sure. So my website, kaufmannprotocol.com, everything is on there. And if you want to know what to take, there's a little app button that sort of, you put your information in, it'll tell you what to take. That's kind of fun. Books are on there, and my 18-year-old daughter created merch if you want to proudly walk around in Kaufmann Protocol merch, which is silly, but it's there.
Dr. Kaufmann, thank you for joining me today.
My absolute pleasure.
MacuHealth, your science-born and tested solutions for visual performance, macular degeneration, and dry eye syndrome. New products coming soon. Embrace the science.